So I welcome you all for today's session. Very good morning to all of you. So today we are going to continue our live series. So today my topic is one of the important topic of community medicine is levels of prevention. You get many MCQs from this topic. So without wasting any further time, let me come on that. Give me a minute. Okay. So I guess you can see my screen also, right? So let me teach you the levels of prevention of disease. Before coming on the levels of prevention of disease, you must understand what is the disease. What is the disease? Now, WHO has defined health. You know the definition of health given by the WHO. Okay, but WHO has not defined the disease. The definition of the disease is given by Susan. Okay, so what is the disease? How we define the disease? What is the disease? How you define? And do you know the difference between disease, illness, and sickness? These are not synonyms. There is a difference between disease. If I say disease, I mean something else. And if we say illness, what do you mean by that? And if we say sickness, what do you mean by that? So there is a difference in the three terminologies and you must understand the minute difference between them. Okay, so let me start with the disease. What is the disease? Disease is the physiological or psychological dysfunction in human body. So just suppose I am the subject and in my body, if there is any physiological or psychological dysfunction is taking place, so I am diseased. Whether I am aware or not aware, I am diseased. So this is the definition of the disease. Any physiological or psychological dysfunction in human body is known as disease. What is illness? Now, sometimes when the physiological or psychological function is very minute and patient is not aware of that. For example, there is some physiological dysfunction or psychological dysfunction in me, but I am not aware of that because it is very minute. It has not yet produced the symptoms. Okay, when the subject is knowing that I'm not well, I'm not being, this feeling of awareness, when the patient is aware that I'm not well, the patient is having the symptoms. Okay, so this is known as illness. Illness is when the disease is producing the symptoms. I mean to say that when the person is aware that the person is not well, that is known as illness. Okay, now suppose I am diseased, I am having some physiological or psychological dysfunction and I'm aware of that. I'm aware of that. So I'm aware of that I am ill. I'm diseased as well as I am ill. But if I'm not aware, I'm having something inside me, some physiological dysfunction, but I'm not aware. So I'm diseased but not ill. So illness depends on the awareness. Okay, now I go to my work. Daily I go to the hospital for the reporting. Okay, now because I am ill, I'm aware that I'm not well. Okay, I'm ill. I will take a leave. I will take a leave from my workplace. I will take a leave from my school, college, or my hospital, or my office, or my workplace. Whatever I do routinely, I will not do that because I am ill. So that social dysfunction is known as sickness. Okay, so whenever you are ill, you take a leave from your workplace, you are socially dysfunctional at that during certain days or months till the point you are not again well. So that is known as sickness. Sickness is social dysfunction. Okay, so if you know, whenever you were ill during the school time, you give a sick leave to your teacher. You don't give a ill leave or disease leave. We always give a sick leave. What is a sick leave? We request our teachers or the boss that we are not going to come to the workplace for certain days because we are ill. So that is a sick leave. Sick leave is the sickness is the social dysfunction. I hope you got the difference between the three. What is the disease? What is illness? And what is sickness? What is sickness? So there is difference between the three. Any physiological or psychological dysfunction is the disease. And the patient is aware of that I am not well. That awareness is illness. And because of the illness, the patient becomes socially dysfunction. That is known as sickness. Give me a thumbs up if you got the three. The difference between the three. These are not three synonyms. You must understand. Now you get simple MCQs on that. And you can easily go for that if you have understood it once. Now I want to prevent the disease. Let's start the topic. Prevention, the levels of the prevention. We can prevent the disease at 4 levels. There are 4 levels of prevention: primordial, primary, secondary, and tertiary. These are the 4 levels of prevention. Let me explain you the meaning of that. Listen. Now there is a normal life going on. Imagine there is a normal life going on. Nothing is there. No risk factor is there. We all know smoking leads to lung cancer. Smoking leads to many diseases. One of them is lung cancer. We all know that. Smoking is a risk factor that is leading to a disease known as lung cancer. Likewise, there are many risk factors leading to many diseases. One of the example we are taking. Now, suppose there is a 3-year-old child. Okay, and we know child don't smoke. None of the child smoke. So that 3-year child don't smoke. So risk factor is absent. There is no risk factor. He don't smoke. Okay, so the father is counseling the child that Beta, you don't smoke. The child is saying, Papa, I don't smoke. So father is discouraging, I know you don't smoke, but in future also you don't smoke. So father is discouraging the harmful lifestyle that in future also. So risk factor is absent. But before the risk factor emerge in the life of the child, the father or the parents, they are discouraging the harmful habit. And they are discouraging that if you smoke in future, you can have many diseases. So in future also, whenever you grown up, then also you please don't smoke. So that is the primordial, the best way of prevention, in which the even the risk factor is absent and the prevention is taken before the emergence of the risk factor. Okay, even risk factor have not emerged yet. Before that, we are taking the action. What is the risk factor here? For example, risk factor is smoking. So the person do not smoke. And we are reinforcing this thought. We are discouraging this thought that, yeah, we know you don't smoke, but in future also you don't smoke. Okay, for example, we are giving the child a balanced diet and we are preventing the obesity because we know obesity is a risk factor for many diseases. Obesity leads to hypertension, it leads to many other diseases, cardiovascular diseases. So we are preventing the obesity. So before the obesity arises, we are giving a balanced diet so that obesity do not occur. So before the risk factor emerge, we are taking the action. That is known as primordial action, primordial level of prevention, the best level. The best level of prevention is primordial. The definition of the primordial, before the risk factor arises. Before the risk factor arises, we are taking the action before that. We are taking the prevention before that. Okay. Now just suppose it is the person who smoke. There is a person who smoke, but he don't have lung cancer yet. He don't have lung cancer. He regularly smoke. There is a teenage 17, 18 years and he smoke. So he's coming to my clinic. So I am counseling the person, please quit smoking. Quit smoking. If you don't quit smoking, now in future you can have many diseases. One of them is lung cancer. So please quit it right now. Okay. So I'm counseling. So the risk factor is present, but the disease is absent. So at this level, if I'm taking the action, it is primary. So there is a difference between the primordial and primary. Students always have confusion. Okay. What is the difference between primordial and primary? Primordial is taken. It is the level of prevention which is taken. The action is taken before the risk factor. And here the primary, the action is taken after the risk factor but before the disease. Okay, यहाँ पे person smoking नहीं करता, not even started. उससे पहले you are discouraging the thought in a child कि future में भी मत करना. You are doing the best thing. Okay, यहाँ पे the person is doing the smoking, लेकिन till now he is lucky, he is not having the lung cancer. So we are counseling कि quit it right now. Otherwise you will have the lung cancer in future. So this is primary. Okay, now the person smoke, I told you na, and he have lung cancer. Unfortunately, he had the lung cancer, but still it is an early stage. Stage 1, stage 2, it's an early stage. So we are taking action after that. We are late and we are taking action after that. So we are taking the action and asking the person to take the treatment right now. है ना? Go for the surgery, go with chemotherapy, radiotherapy, whatever treatment option available, take it right now. Early treatment, early diagnosis, get it diagnosed and get it treated. So early diagnosis and early treatment. So we want to halt the disease at early stage. At least the person don't have metastasis. At least the persons don't have the complications of that. So we want to halt the disease, stop the progress of the disease at early stage. So here we are taking the action after the start of the disease, but before its complication. So that is known as secondary level of prevention. Okay. So primordial, it is the action taken prior to the risk factor. Primary, the action taken after risk factor, but before the disease appears. And secondary, the action taken after the disease appears, but in early stages, not in late stages. Now imagine the person is already having the metastasis also. The person smokes, he had the lung cancer and he has the mets. Okay, it is already having complications and late stage. Okay, so what we can do now? So whatever action we will take now, it is only rehabilitation. So if we are taking the action after the late stages of the disease, we are doing the rehabilitation, and that is known as tertiary level of prevention. How many of you got it? How many of you got it? Thank you so much for your compliments. Thank you, Abhishek. Thank you, everyone. Okay. So how many levels of prevention we have studied? There are 4 levels of prevention. Can you tell me the definitions of them? So the first thing you must understand the definition. Primordial level of prevention, primary level of prevention, secondary and tertiary level of prevention. So can you tell me when we are taking the action? In primordial, we are taking the action prior to the emergence of risk factor. Before the emergence of the risk factor. Risk factor have not yet arrived. Before that, we are taking the action. The best example, discouraging a child, a 2-year, 3-year, 1-year-old child that don't smoke in future also. So that is the best example. The father is counseling the child that you don't smoke, I know, but in future also you don't smoke. So that is before the risk factor arises, we are discouraging it. Okay, we are taking the action. That is the best. Second best is primary. Here we are taking the action after risk factor. After appearance of risk factor, okay, but before disease. It is after risk factor but before disease. before the disease. Here we are taking secondary, we are taking action after disease, है ना, but early stages of disease. We are preventing it to the late stages of disease. And here we are taking the action after late stages of disease, after late stages or complication of the disease. So in this way, we can understand the 4 type of level of prevention. How many of you got it? How many of you got it? If you got it, it's very easy to understand all the examples. You get many MCQs based on that. So this is the basics. Shall I repeat, or you all got it? Give me a thumbs up if you all got it. Or does anyone want me to repeat the 4 levels of the prevention? Okay, so we will understand them one by one. The first one is the primordial with examples and with their modes of intervention. So there are 4 levels of prevention. Each of them have two modes of intervention. There are two modes of intervention in each of them. So total we are having 8 modes of intervention, 2 in each. There are four level of prevention, two mode of intervention in each of them. So total 8 modes of intervention. Let me tell you the modes of intervention. So we will see one by one. So first start with the primordial level of prevention. What is primordial? I told you here we are taking the action before the emergence of the risk factor. Before the risk factor have not yet arrived. Before that we are taking the action here. Before the risk factor have arrived, you can see it is primordial. It is the best level of prevention. For example, discouraging the child from adopting smoking. The father is counseling the child that I know you don't smoke, but in future also you don't smoke. So this child don't smoke. So smoking is absent. So before it appears, we are discouraging it. That is the best level of prevention. I told you. There are 2 modes. Either individual education, so it is 1-to-1. The father is counseling the child. The parents are counseling. It is 1-to-1. Or it can be mass. On the TV, on radio, in newspaper, on internet. We can give such ads. Which discourage from the harmful habits before they arise. For example, whenever we go to a movie in a theater, there is an ad which shows that smoking leads to lung cancer. So there are many children also who are watching that movie. They don't smoke. So looking at the ad, we are doing mass education that smoking is harmful. So just discourage it. So either it is individual level, 1-to-1, or it can be a mass education. So these are the 2 modes of intervention for primordial level, 1-to-1 or mass. Okay, now coming on the primary level of prevention. Here we are taking the action. Okay, here we are taking the action after the risk factor, but before the disease. The disease have not yet occurred, but the risk factor have already occurred. You can see risk factor is already present, but disease is absent. At this level, we are taking the action. So person already smoke. The person do not have the lung cancer. There is a teenage 17-year-old coming to my clinic, or he is my relative or some friend. I'm advising him, quit smoking. Otherwise you will have lung cancer in the future. Till now you are lucky you don't have, but quit it right now. So this is the action we are taking after the risk factor, but before the emergence of the disease. So action taken prior to the disease, but after risk factor. This is primary. So there are 2 ways. What are the modes of intervention? There are 2. Number 1, health promotion and specific protection. What do you mean by health promotion? What do you mean by specific protection? Health promotion is generalized. Whatever advice or action we are taking, it is generalized. It is not for one disease. For example, if I am advising someone, adopt a healthy lifestyle. What is healthy lifestyle? You do gymming, jogging daily, you do exercise. So which disease is this preventing? It is preventing multiple diseases. Multiple. So it is not for one disease. It is for multiple disease prevention. If we say environmental sanitation, protection, it is for multiple disease. If we ask the person to take a balanced diet, it is not for one disease. It is for multiple disease. If the person take a balanced diet, the person will not have anemia. The person will not have multiple diseases. The deficiency disorders because of the balanced diet. Okay. So it is health promotion. It is non-specific. But specific protection is specific. The action taken for a specific prevention of a disease. Specific disease. Okay. For example, if we are doing immunization, if we are giving immunization for OPV, only polio will be prevented, not other disease. If we are giving a vaccination of BCG, only TB will be prevented, not others. So whatever, if we are giving vaccination for COVID, so only COVID will be prevented, not others. So whatever vaccination we are giving, okay, the first thing you have to understand, vaccination is a primary mode of prevention. All vaccines, whatever vaccine you talk about, whatever vaccine, it is primary mode of prevention. What do you mean by that? In the risk factor, in the environment, the mycobacterium TB is also present, diphtheria is also, all the microorganisms are present here, and it is exposing the child. So risk factor is already present, but child do not have disease yet. So that's why we are giving the vaccine to the child so that disease do not develop. So risk factor is already present in the environment. In the environment we are living now, it is full surrounded by the risk factors. So all the organisms are already present. Whatever we eat, whatever we drink, whatever we inhale, risk factors are there. So microorganisms are everywhere, है ना, in the soil. So microorganism, I mean the risk factor is present, but we don't have disease. So we are giving the vaccination after the risk factor, but before the appearance. So all vaccine will come in primary level of prevention. Chemoprophylaxis also come here. Fortification of the food. You know, we eat salt which is iodized. Why we eat salt which is iodized? Because iodine deficiency is very common, especially at the hilly areas, and the person can develop goiter. So that's why the government is doing fortification of such a food item which is consumed by everyone. So salt is something which is consumed by even poor, even by the rich, even with everyone, Hannah. So we are doing the fortification. Okay, so it will also an example of primary. Okay, usage of the bed net. Sometimes we have many mosquitoes, especially in the rainy season, and mosquito bite can have certain diseases like malaria, like yellow fever, Hana. These are the diseases caused by dengue, by the mosquito bite. So if we are applying a bed net before going to the sleep, so all the mosquito wala diseases will be prevented, Hana. But it will not help me for anemia. It will not help me with other diseases. The bed net will protect me for the diseases which are caused by mosquito. So it is coming in the specific protection. You got my point? Yes. So I'm teaching you the levels of prevention. So I taught you first is primordial level of prevention. The second I taught you primary. The third is secondary, and fourth is tertiary. Definition, you got it very clear. I guess you all got the definition of them very clear. Now we are understanding the two modes of intervention in each of them. In the primordial, the two modes of intervention I told you, individual education and mass education, and we have understood well with the examples. Hana. In the primary, again, I am teaching you the two levels of intervention. The first is health promotion, which is non-specific. Hannah, health promotion is non-specific, like adopting a healthy lifestyle, eating a balanced diet, environment cleanliness. Okay. And specific protection is for specific diseases. So we are taking action for the protection, like uses of bed net. So it will protect only for malaria. Vaccination, particular vaccine give protection only for particular disease, like that. Okay. Now coming on secondary level of prevention, Hannah. And here also I will tell you two modes of intervention. So what is a secondary level of prevention? What is secondary level of prevention? I told you in primordial, we are taking action prior to the risk factor. Even not the risk factor. Child don't smoke. Before that, we are discouraging don't smoke in future also. That is primordial. Here the child smoke, the teenage smoke. And the teenage don't have lung cancer in primary. So we are taking the action after the risk factor, but before the disease, that is primary. Now I'm talking for secondary. The person already have the lung cancer, but in early stages. It is not late stages. It is early. So we are taking the action here. So we are asking the person to do two things: diagnose, treatment. Because it is early stage now. Get diagnosed. Go to the doctor. Get diagnosed right now. And whatever is the treatment, take it right now. So that we can halt the disease at early stages. So it halts the progress of the disease at early stage, and we are preventing the complication because disease is already there. We are taking the action after disease, not before disease. We are taking the action after disease. Okay. So we are arresting the disease at early level and we are treating it as soon as possible. But this is very expensive and less effective mode of prevention. But all the government health programs, national health programs work at this level. It's a question. It's a PYQ. All the national health programs work at this level, but it's very expensive. So here the two modes of intervention is early diagnosis and treatment. So there is a person who is coughing constantly, and the person is having weight loss also, and evening a rise of fever. So we will do a sputum test for TB. So we are doing early diagnosis, and if it is positive, we will offer DOTS. So that is treatment. So early diagnosis and treatment will come here because person already have the disease. Okay, that is secondary. And finally, the tertiary level of prevention. The person already have late stages of disease. Now what you can do? You can only do rehabilitation. The person already have late stages of disease and you are taking action after that. So we are taking the action after late stages of disease. It is intervention in the late phase of the disease. Okay, so the main purpose or motto of this level of prevention is to reduce or limit the impairment and disabilities. That is rehabilitation. So what are the two interventions here? Disability limitation and rehabilitation. For example, if we are doing physiotherapy in a polio, the person already have the polio. The child already, now we cannot reverse it. It's already there. It's already there in late stages. So what we can best do is the physiotherapy. So we are offering physiotherapy in a polio person. Okay, got it. We are providing crutches to the polio. The person already have the polio, but at least we provide the crutches, the person can walk. So we are providing crutches or calipers. Okay, we are providing the crutches or calipers to the polio. We are doing reconstructive surgeries in the leprosy, है ना? And we are providing school to the blinds, है ना? Schooling of the blinds. Okay, you can see it is for the vocational rehabilitation so that they can get some job, okay, some occupation. So we are providing schooling for the blinds. So this is all tertiary level. The disease is all, the person is already blind now. The person already have the polio. The only thing we can do the rehabilitation, the various types of rehabilitation. How many of you got it? So we have seen the 4 types of level of prevention along with two modes of intervention. Got my point? So can you tell me the 4 levels of prevention? It's very easy. Primordial, primary, secondary, and tertiary. You know the definition. I want you to tell me the two levels of intervention so that we can solve some questions now. Okay, primordial 2 levels of intervention. What are the 2 levels of intervention? Individual education and mass education. These are the 2 levels of intervention in primordial. In primary, it's health promotion, that is non-specific. Health promotion is non-specific, and specific protection is specific for certain disease. I have given you the example. In secondary, again we are having 2, early diagnosis and early treatment. Early diagnosis and early treatment, because the disease is already there. Get it diagnosed, get it treated. Okay, and in tertiary, we are having the 2. Which 2? We are having disability limitation, disability को limit करो, disability limitation and rehabilitation, है ना? Like the schooling for the blinds, rehabilitation. So please learn the 2 levels of intervention in the 4 modes of levels of prevention. So total 8 levels of intervention, modes of intervention are there. So if you understood it well, we will solve certain examples. Are you people ready? Can you give me the answers now? I will ask you the questions. Can you give me the answers? You have to tell me two things. Whatever question I will put in front of you, I will put few questions, and I'm having 15-20 questions with me. Okay, so I will put the questions in front of you. You have to tell me 2 things. Number 1, you have to tell me which level of prevention. Is it primordial, primary, secondary, or tertiary? Number 1, looking at the question. And number 2, you have to tell me in that level of prevention, what is the mode of intervention? What is the mode of intervention out of the 2? Each level of prevention have two modes of intervention. So out of that 2, if you are saying primordial, what is the answer? Is it individual or is it mass? If you are taking primary, so what is the answer of the modes of intervention? Is it health promotion or specific protection? Likewise. Okay, so you will tell me. So read the question, okay, and tell me the answer. Read the question first. There is a patient. Read the first word. Patient. Patient matlab there is a person who already have the disease. You got your answer. There is a person who already have the disease. That's why we are using the word patient. The patient is having cough and fever. Symptoms are already there since last 3 weeks. And now the patient is coming to the DOTS clinic for sputum testing. For testing of acid-fast organism, sputum testing. So we are collecting the sputum and we will do the test whether the test is positive or negative. So what actually we are doing? We are doing primordial level of prevention, primary level of prevention, secondary level of prevention, or tertiary. First you answer. Absolutely right, Abhishek. And I want everyone to answer. Yes, it's secondary. It's secondary level of prevention because the person already have the symptoms. It's a person who have the disease. So we are taking, we are doctors, we are taking the action after the disease have occurred. Hana, we are just doing the diagnosis. Hana. So it is secondary level of prevention. Absolutely right. What is the mode of intervention? In the secondary level of prevention, we are having 2 modes, diagnosis or treatment. What we are doing here? We are doing diagnosis or treatment? We are doing diagnosis. So my answer is it is secondary level of prevention and mode of intervention is early diagnosis. So secondary level of prevention and it's early diagnosis. It's early diagnosis. The mode of prevention is not treatment. The second question, it's related. It's related. Now read the second question. There is a patient. Again, you read the first word. The first word is giving me the answer. What is a patient? The patient is a person who already have the disease. So we are talking about a person who already have the disease. Hannah. And sputum is already positive. Hannah, he is having cough. Hannah, maybe this is the only patient and sputum is coming positive. Now sputum is positive and we have categorizing it's cat 1 patient having the TB and we started under DOTS. We are giving the treatment. So what we are doing actually, we are taking action after the disease. Hannah, the disease have already occurred and we are treating the patient now. So again, it's secondary level of prevention, but this time it's treatment. Because in secondary level of prevention, there are 2 modes of intervention. Here we were doing the diagnosis, it was also secondary. And here we are giving the treatment. Hannah, so it is secondary, but here we were doing the diagnosis, here we are giving the treatment. So you have to be very specific for your answer. Got my point? Now look at the third question. Look at the next question. There is a patient. Again, look at the first word. There is a patient who is having fever and chills. So person already have the disease, whatever disease it is. The patient already have the disease. So it is secondary level of prevention. The patient is coming to the malaria clinic for peripheral examination. So we are making the thick smear and thin smear. So we are doing the diagnosis. Hana? So again, it is secondary level of prevention and we are doing early diagnosis because the person already have the symptoms. Hana? We are taking action after the disease have occurred. Okay, got it? Hana? See the next question. There is a person sleeping inside the bed net. Why the person is sleeping inside the bed net? What is the level of prevention? Is it primordial, primary, secondary, tertiary? First, decide your level of prevention. Once you are done with the level of prevention, then tell me the mode of intervention. Each level have two option of mode of intervention. So first, decide the level of prevention. Is it primordial, primary, secondary, or tertiary? What do you say? Why the person is applying bed net? Because there are many mosquitoes in the room. Anna, there are many mosquitoes in the room. So that person do not want that the mosquito should come and bite the person. That's why this person, this lady is using a bed net. Hana. So risk factor is the mosquito. It is present. Risk factor is present. But risk factor, the mosquito have not bitten yet. Hana. So it is not bitten yet. You got my point? So the disease is absent. So risk factor is present, but disease is absent. You are getting my point? So it is primary level of prevention. It is not primordial. You know, it is primary, it is not primordial. Students confuse that, ma'am, is why not it is primordial? So my answer is, person is using bed net because mosquito is present now. Mosquito present होगा तभी तो bed net लगाएगा, ऐसे तो नहीं लगाएगा ना. So risk factor is present. You know, risk factor is present, but disease is absent. In primordial, risk factor should be absent. Okay, here risk factor is present, disease is absent. So it is primary. It is primary level of prevention, not primordial. In the primary, there are two options. In the modes of intervention. Is it health promotion, which is non-specific, or specific protection? So applying the bed net, it will give protection only for mosquito wala disease. Mosquito, the diseases in which the vector is mosquito, like the malaria, dengue, you know, yellow fever, not others. It will not give the protection for other diseases. It will not give protection for anemia, goiter, and others. Okay, so it is specific protection. So my answer is primary level of prevention and specific protection. So to be very specific, okay, your answer should be very clear. What is the level of prevention? And in that level of prevention, what is the mode of intervention? Because each level of prevention have two options. So you should be able to opt it. So in your MCQs, sometimes they ask you the level of prevention, sometimes they ask you the mode of intervention. So the concept should be clear in your mind ki whether they are asking level of prevention, I am having 4 options. Primordial, primary, secondary, tertiary. And if they are asking mode of intervention, I am having 8 options, 2 in each. Okay, got my point. Now read the next question. There is a child coming to immunization clinic for OPV vaccination. We are giving the vaccine to the child. We are giving vaccine. What is a vaccine? This child don't have the polio. But the polio virus is present in the environment. This is the virus causing the polio. It is present in the environment. So I mean to say risk factor is present, but the disease is absent. So we are taking the action when the risk factor is present, but disease is absent. Okay, so it is primary. Not only this vaccine, all vaccines, immunization is primary level of prevention. And in primary level of prevention, it is specific protection. Because this vaccine will give only for protection of polio, not for other disease. So it is primary level of prevention and specific protection. It's crystal clear. Got it? The next question is in front of you. A little bit confusing. But don't confuse. Look at the options. We are applying a urine strip test for sugar detection to screen. The biggest word here is the screening. We are screening for diabetes in a community. For example, there is a colony, there is a community having 100 people in that. This is the 100 people. Okay, 100 people are residing here. 100 persons are there, 100 people are there. And we are applying the urine test. So we are collecting the urine of all 100 and we are applying the strip test in that to see which is diabetes and which is not diabetes. Which is having diabetes. So we want to screen. What is screening? We perform the screening in the person who think they are healthy, but actually they are not healthy. The disease have already started inside them. They are apparently healthy. Okay, so actually some of them out of 100, maybe 10, maybe 20 are the people who think they are healthy, who don't have any symptoms, but actually the diabetes have already started inside them. They don't have symptoms yet. Got it? So actually they don't have symptoms, it's okay, but the disease is there. I told you the definition of disease. The definition of disease is not dependent on symptoms. It is illness we are talking. So disease is something that is psychological or physiological dysfunction is already there. Maybe I'm having some physiological disorder inside me, but I'm not aware because I don't have symptoms. So I think I'm healthy, but actually I'm not healthy. I'm apparently healthy. I think I'm healthy, but actually the disease have started inside me. So if you do the screening test, you will get it positive in me. So in the same way, the disease is present. The disease is present, but in early stages. because patient don't have symptom yet. It is early stages. So this is secondary level of prevention. I hope you got it. So all screening test is secondary level of prevention. In the secondary level of prevention, we are doing early diagnosis. We are doing early diagnosis. Okay. So all vaccines, whatever vaccine they give you, they will give you different name of the vaccines to confuse you. All vaccine come in primary level of prevention. Okay. And all screening test, they will give you different tests different time. For example, pap smear for cervix cancer, breast self-examination for the breast cancer. Okay, so different screening tests are there. Currently we have seen the urine test for the diabetes, urine sugar strip test. So different, all screening tests will come under secondary level of prevention. Secondary. So these are two very commonly asked questions in your exam. You must understand it. Vaccines are primary level of prevention and screening tests are secondary, and you must understand the reason behind that. You must understand the reason behind that. I hope you got it. So let's read the next question. There is a village community and we are doing the counseling. You are going to a village and you are counseling the village people how to prevent the spread of malaria. Because this village have many cases of malaria. This village have many cases of malaria very frequently. So we are going to the village and we are counseling the people and we are telling the ways how to prevent the malaria. Use the bed nets, wear full sleeves dress, and don't go in open and play. And if you are going, apply the, there are creams available, which mosquito repellent creams, so apply that like that. So we are telling them many ways, and there should not be stagnant water at your home. So there are many ways to prevent the malaria. Okay, so we are explaining them. So what actually we are doing? So these people don't have malaria yet. इनके गांव में बहुत होता है लेकिन इन लोगों को नहीं है. So we want to prevent it. So risk factor is present but disease is absent, and we are taking the action at this level. So what is the level? This level is primary. No, not primordial, Abhishek. This one is primary. Because risk factor is present. Now mosquitoes are present. Okay. And we are giving a healthy promotion, specific mode, specific protection. It's the specific protection. Okay. The next, I guess everyone knows, there is a 5-year-old child and the father is discouraging from adopting the harmful habits like smoking. The father is counseling the child. I know you don't smoke, but in future also you don't smoke. So what the father is doing? It is discouraging the harmful habits to adopt the harmful habits in future. Okay, so your risk factor is absent. This child don't smoke. This child don't smoke. Risk factor is absent. And you are taking the action before the risk factor arises. So it is primordial. So here the answer is primordial. Say yes. Got it. It is a primordial level of prevention. Got it. Hannah? And it is individual, one-to-one counseling. Okay. Got it. The next question, you are providing crutches to a person who is having polio. To a patient who is having polio. So the disease is already present. The person already have the polio. So disease is already present. Now what we are doing? You are doing the rehabilitation. It's already in late stages. The person already have the paralysis. You cannot reverse it now. So what you are doing actually? You are doing the rehabilitation by providing the crutches, calipers. So it is tertiary level of prevention. Tertiary. And in which we are doing the rehabilitation. In the tertiary level, we are doing the rehabilitation. Got it? Immunization we have done. Okay. Arranging the school for the blinds. Arranging the school for the blind. So person is already blind. The disease is present. You cannot reverse it. The only thing you are doing the rehabilitation, vocational rehabilitation. Okay. So that they can get the occupation if they have done their schooling, they are educated, they will get some or other job or occupation like that. Okay. So we will solve some MCQs also after that. Read the question. It's a confusing question, a little bit confusing question. But I guess it's very easy. Okay. Read the question and tell me the answer. In an area with fluorine rich water, in an area, we get water, government supply does the water. Where there is no government supply, we do the boring, we use the boring water. So here government is supplying the water, government is supplying the water to the city. Okay, so there is a community which is getting the water which contain abundant of fluorine. Excess of fluorine causes the disease. It's not good. So it's not good. Excess of fluorine causes fluorosis. Skeletal fluorosis, dental fluorosis. There are various manifestations of the fluorosis. We do not want that whosoever is drinking the water, they should have fluorosis. No. We do not want. The persons should have fluorosis who are drinking, consuming the water. So before supplying the water, government should do the defluorination. Government should do the defluorination by Nalgonda technique. If you may be knowing, there is a Nalgonda technique that I will teach you. In Nalgonda technique, we remove the excess of fluorine which is present in the water. Okay, so what actually the government is doing by doing the defluorination before supply? So the fluorine is excess. Okay, so risk factor is present. Risk factor is present. But the persons, it is not going to the city. The persons have not consumed this water. So before the persons consume the water, we are removing the fluorine. So we are removing the fluorine before the disease occurs. So risk factor is present, but before the disease occur, disease is absent, we are taking the action. So it is primary level, it's not primordial. So students get confused here. You people say, ma'am, why not it's primordial? Because I say risk factor is present. The water present, the water contains the fluorine. It's written it's fluorine rich water. The fluorine rich water, matlab risk factor is present. Hana, risk factor is already present. Hana, but the persons have not yet have fluorosis. So before they develop the fluorosis, the government is doing the Nalgonda technique. It is removing the excess of fluorine. So it is primary level of prevention, and it will give protection for specific disease. Only for fluorosis, it will not give protection for polio or other disease. Okay, so it is specific protection. So my answer is primary because we are taking the action here. The risk factor is present, but the disease is absent. The risk factor is the fluorine. Fluorine is present in the water, but fluorosis have not yet occurred. So we are taking action at this level. The next question, what is the definition of primordial prevention? Read the 4 options and tell me the definition. What's the definition of primordial prevention? Can you tell me what is the definition? It is action taken prior to the disease. It is prevention of emergence of development of the risk factor, that is before the risk factor. Or is it action taken to remove the possibility that the disease will ever occur? Or it is action that will halt the progress of the disease? What is your answer? What is your answer? Think before you say the correct answer. I'm asking for primordial. Primordial level of prevention is something we take the action before the emergence of the risk factor. We are discouraging the 3-year-old child that don't smoke in future also. So risk factor is absent. So answer is B. You got my point? B is the answer. It is prevention of the emergence of the risk factor. By risk factor के आने से पहले उसको जड़ से, it is tear it out. Just tear the risk factor so that in future also it will not come. Okay, so it is prevention of emergence of development of the risk factor before they arise. That is primordial. So correct answer is B. You all are correct. Very correct. My next question, in the same question, if I change the question to primary, what is your answer? No. I'm changing one word in the question. Instead of primordial, I'm asking primary. So what is your answer? Would you like to change your answer? You should change your answer now. What is the correct answer now? What is the correct answer? Yes. What is primary level of prevention? Can you tell me what is primary level of prevention? Anyone can tell me? What is primary level of prevention? So it is the action taken prior to the onset of the disease. The risk factor is already present, but person already smoke, but lung cancer have not yet occurred. So this is primary. In that case, my answer is A. You are absolutely right. If I'm changing the question again to secondary level of prevention, what is the answer now? Would you like to change it now? Yes, you should change it. What is secondary level? So in the same question, I'm changing the question. You are changing the options. So what is secondary? We are taking the action to halt the progress of the disease in early stage so that disease do not go to late stage. So we are taking action after the onset of the disease, but still the disease is in the early stage. The complication yet not have occurred. So this is the answer. In that case, answer will become D. Answer will become D in that case. I hope you are getting it. So we are halting the progress of the disease from early stage to late stage. I mean, we are taking the action after the onset of the disease at early stages. In that case, answer will become D. Not C. The answer will become D. No, not C. This is not any option. Action taken so that we remove the possibility that disease will ever occur. No. There is no such prevention. That disease kabhi hoga hi nahi, iski guarantee to koi nahi le sakta. So there is no such prevention. Got it? Okay. The next question. Childhood obesity prevention. We are giving the healthy diet to the child so that child do not have overweight or obese. No. We are preventing it. Child do not get obese. So what actually we are doing? So because the child, we do not want our child to become obese because obesity, obesity is a risk factor. Risk factor for many diseases. If the child is obese, in future the child can have hypertension, cardiovascular disease, ischemic heart disease, or many other diseases. Obesity is a risk factor for many diseases. Breast cancer. So we do not want the child to be obese. So we are asking the child to be physically active and we are giving a balanced diet so that the weight gain should be within normal range. It should not be obese. So before the appearance of the risk factor, before obesity appears, we are preventing it. So we are doing primordial, not primary. You are again getting confused. I'm not saying the child is obese. I'm saying we are preventing the child to be obese. Like I have told you, there is a 3-year-old kid who don't smoke and we are discouraging the child don't smoke in future also. So currently child do not smoke. So risk factor is absent. Currently child is not obese. We are preventing it. We are preventing it to be obese. Risk factor is absent currently. I'm saying prevention of the obesity. Obesity is not yet present. Abhi hai nahi obesity. I'm not saying, if I say the child is already obese, it will be primary. But if I'm saying I'm preventing the child to be obese, it's primordial. It's primordial. So there is a difference. Whatever I'm asking, there is a difference. So answer will be primordial, not primary, because we are taking the action prior the risk factor to be arise. Obesity is a risk factor. So there are 2 ways of asking. If I say child is already obese, so your answer will be primary. And if I say I'm preventing the child to be obese, So your answer is primordial. Hannah, got my point. So this is all the questions I taught you. Hannah, the levels of prevention. It was a very small topic, I know, I taught you, but yet the topic was small, but yet very, very important for whatever exams you are targeting. So I've taught you many MCQs I have shown you, which are frequently asked in your exam. And this is a list of university exam question if you're preparing for your third prof exams. So this is the important questions which are usually asked from this topic. You get a short or very short question. Hannah, sometime rarely you can get a long question also, but usually you get a short question from this topic. Okay, but this topic is really very important. So for both the students, I hope you got it. Everyone got it, huh? If you want the notes of this topic, you can see there is the link which is pinned currently. Now also you can see the link in the chat box. The link is pinned. If you click on the link, you will get the notes of all the topics which I'm teaching you on YouTube in this live series. So I've started this live series on which, and every Monday, Wednesday and Friday I come live morning 9:30 a.m. with one new topic every day, Hannah. And the topics are chosen by the students only. So students only message me that, ma'am, teach this topic, that topic from various subjects. And if many students are demanding for the same topic, I select that topic and schedule it in the YouTube classes. So I will keep continuing this YouTube classes live for the benefit of the students. And whatever topic is in your mind you find difficult, you can text me. So this is the contact number on which you can send your difficult topic of choice, which you find difficult and you want me to take it on YouTube by my side. Okay, so this is the contact number. You can note down. It's only for chat support. It is not for calling. So don't call it. And you can message here on WhatsApp. Okay, or SMS you can do. It's 9321001485. You can do the WhatsApp. Okay, whatever topic, or if you find any difficulty, if you have any query, you can ask it here. Okay, and here is the QR code for the website. The website is MedLive by drpriyanka.com. If you scan this QR code, you can scan it right now. It will divert you on the website on which you can connect with me on various social media platforms like Instagram, Telegram, WhatsApp. You can connect with me where I'm sharing many things which are related to your exams. Hannah, informative educational stuff I'm going to share there. Okay, so that's all about it. Thank you for your time, your attention, for your patience. Thank you so much. And the next session, today we have seen 11th of December. It's level of prevention from the community medicine. The next session is on 15th of December. Hannah, so today is Monday. This Wednesday I'm having some other commitment, but on Friday we are meeting again. This Friday, 9:30 a.m. That is on 15th, with a very important topic again from community medicine. That is properties of screening test. Hannah, many numericals we are going to solve here. So I want you to get ready with your notebooks, with your pens and notebooks, because I will help you in solving many numericals here, which are important for your competitive exam as well as prof exam. Hannah, so I will teach you sensitivity, specificity, positive predictive value, and negative predictive value of a screening test. So it's a very difficult topic to understand, but I will make a cakewalk for you, believe me. Okay, so we are coming with the next topic, and after that, other topics are from pharmacology after that. So stay tuned, stay connected. And if you have any doubt, please you can ask. Thank you so much. Bye-bye. I'm ending the session. Wishing you all the best for your exams. Bye-bye.